Monday. What's up, everybody? Cool deal. Let's hit this thing from the top. Hope everybody's doing great. October 23rd, 2023. Got a little bit of a late night show here. Anyways, how's it going? Good evening, everybody. I'm Dr. Joaquin Acosta. For those of you who don't know me, your trusted pharmacist, the driving force behind Farm True, and your host for tonight's engaging episode of the Know Your Pharmacist livestream. As we unravel the ongoing narrative of the Walgreens walkouts, tonight is not just another episode, but a continuance of a crucial dialogue, one where resilience meets advocacy and where every voice counts. So, guys, as the saga unfolds with another strike on the horizon, we stand in solidarity with our fellow pharmacy technicians and our pharmacists seeking a better work environment. Our Pharmacist Frontline segment will delve into the latest updates, shedding light on emotions and ethos driving behind these actions, guys. So now, after that, we're going to shift gears to Tech Talk, where we'll explore the heartbeats behind the pharmacy counters. In our Tech Talk today, we're going to be talking about pharmacy technicians, and we will be making sure your plea is also not unheard. So we'll go through that, okay? We don't want raises, we want help, we get it. American Pharmacist Month is still in process. So amidst these challenges, we want to celebrate the essence of American Pharmacist Month. In our Enlightenment Hour, we're going to explore the demanding yet rewarding days of our pharmacy professionals, emphasizing the empathy and expertise that fuel our service. And in our Herbal Wellness Corner tonight is a fascinating delve into pediatric cannabis treatment, bridging ancient wisdom with modern science by Bonnie Goldstein, Dr. Bonnie Goldstein herself. We're going to watch a little video. So get ready for that one. In our community spotlight, shining on a light on New Mexico's recent vaccination drive, Boo to the Flu, and where to find that here in Las Cruces. Testament to collaborative efforts forging a healthier tomorrow. And men, don't think we forget about you. Our Men's Health Minute tonight tackles the Monday mental block, providing insights to conquer this week with vigor. Before we dive into these captivating segments, huge shout out to our incredible show sponsors, Farm True, High Horse Cannabis Company, the Trichome Alliance, and Vado Speedway Park. Your support fuels this enlightening journey, making every episode a step towards a well-informed and health-conscious community. Thank you very much, guys. Together, let's embrace the power of knowledge, foster understanding, and create a ripple of positive change. Welcome to the Know Your Pharmacist livestream. American Pharmacist Month is still going on, baby. So, chatting with you guys about this. Walgreens pharmacist looking to stage a new walkout. You guys aware of that? I'll share that with you here. So again, already walked out once earlier this month. Walgreens is misreporting the walkout numbers as opposed to the self-reported walkout numbers. So those are some numbers that aren't adding up, probably intentionally. I think Walgreens said only 20 stores of theirs had been affected by any of the walkouts, and some of the self-reported numbers were showing over 600 employees walking out and lots of critical staff that were really participating. So Walgreens trying to minimize that from their side, not good. And that's why here at the end of the month, again, Walgreens staff are going to go ahead and stage another walkout, still trying to negotiate exactly what they want. So we'll go through this, right? It's simply a negotiation between the workers and Walgreens there, and understandably so, right? Looking at what their reasons are for doing this. Very, very interesting, because here, as you see, statement to CNN, Walgreens said 20 stores out of the 9,000 stores that they have had disruptions over 3 days. With Walgreens organizers telling CNN, again, their tally is much higher, with 600 employees participating, right, which probably would affect over 20 stores. Especially by the way Walgreens staffs their stores, probably put 4 people per every 100,000 people that they serve. So, more than 20. Anyways, other parts that CNN was looking at, right? Parts of the stories that I do want to make sure get shared and highlighted, because not why do I talk about this a lot? Because again, it's American Pharmacist Month. This is a very, very, very relevant, semi-ignored piece of media right now, and maybe workers' unions and things like that have been minimized and reduced over time to whatever that they may be particularly compartmentalized in our government and society. That's fine. However, a weirdly overlooked situation here for the pharmacy teams and the future of pharmacy there is a very, very important aspect that, at least to me, is important. So that's why, of course, we're sharing this with you. Looking at this here, having pharmacists leave in tears. A pharmacy manager in Oregon knew the pharmacy couldn't run without him there. When he called out on October 9th, the pharmacy closed and reopened it the next day because there's a lot of people on his staff that need to work and want to work, right? So either way, it couldn't just be on one person, and right. So maybe there's going to be more, either more participants or different types of participation this time, right? What we do know is Walgreens employees are supported by, I believe, the American Union Society and things like that. However, American Pharmacist Association has not necessarily been as helpful, and that's weird. Anyways, just looking at the life of a pharmacy technician and or even pharmacist, thinking about the job, it's exhausting to get yelled at multiple times a day. A tech and immunizer in Wisconsin described her typical day to CNN. The pharmacy counter has patients lined up to the freezer section of the store. The drive-thru has stacks of cars nearing the neighboring streets. 50 scripts are waiting to be typed. 650 are in the filling station. 200 scripts waiting to be verified or for sale by the pharmacist. Dozens of warehouse totes filled with medication waiting to be on our shelves, right? Hundreds of rejected insurance claims needing to be resolved. Hundreds of prescriptions overdue. Dozens of patient care calls overdue. Hundreds of out-of-stock medications needing attention. Dozens of prescriptions needing to be mailed. Dozens of prescriptions needing to be prepared for DoorDash. Dozens of prescription requests sitting in the message queue. And the pharmacy is expected to act like a fully functioning vaccination clinic, right? And again, right, those are high expectations. And for every single person that has worked in the pharmacy, especially in retail, right, we understand how real that is, right? However, maybe the patients and things like that don't understand. And what we expect, especially in a retail scenario, is like fast food, right? You want to go fast. You want to have good customer service, patient care, all of that. You really should be, but you can't do it when you're looking at this amount of volume of other things going on. And again, it doesn't present in a way that really, really favors a big backlog of work, right? These systems do not accommodate for the fact that, prescriptions could be due for different people on different days or whatever that may be, or where they would be in the waiting bin already. Keeping things consolidated and easy is not necessarily a part of that. It's just a whole bunch of different queues that are yelling at you all day long, right? Flashing at you. You're always behind. So it doesn't create a situation of, support and you're okay to be where you're at, because again, truly, this is not a lie. How many people remember going to a pharmacy like this in the last year? Pharmacy counter, patients lined up to the freezer section of the store, drive through stacks of cars, neighboring street. Boom. Already think about how mad each and every single one of those people comes to the pharmacy counter when, you go there, your things aren't ready. And then all of a sudden you're pissed off because you just waited 45 minutes in that line expecting it to be ready. And that's totally fair. But again, you're working completely against the grain here if you're tech, right? And then, or even a pharmacist in those situations, and you're getting yelled at each and every single time you deal with a customer because everything you do is behind. You can never have something done for somebody on time because you're sitting there, working like that. And it's not efficient. It's not a good way to do things. Does it guarantee, I guess, maybe from the corporate perspective that there's always work to be done? I guess, right? It keeps the pharmacy people needing to do pharmacy tasks all the time, but they're not always caught up. And that balance between how much can people handle versus where are people going to start skipping? Where is patient care going to start, being really affected? Where is this going to be a problem? It's not in their minds. That's not where Walgreens CEOs and CVS CEOs and Rite Aid CEOs are thinking about right now, about cutting costs. And I get it. But really, what's happening on the underlying thing is they're trying to phase out costs, phase up automation, phase out, humans. This is all currently still happening, right? So looking at this, the plea in the negotiation, right? One of the things, we don't want raises, we want help, right? Again, what is help even defined as? Help, just more staff to work. And again, I mean, part of that negotiation is more than just that. But when you're looking at trying to put patients before profits, the companies are saying they're doing it to save face, but then all these people who paid hundreds of thousands of dollars to go to school are telling you this is not the truth. Plus technicians as well. You can't believe the one entity that gets to talk on the media and say one thing. Like, you got to look at all those people that are working there. There's something wrong, right? And it doesn't have to be like that. So that's what we're talking about. Walgreens walkouts are staged again for the end of the month, October 28th, I believe. So the organizers, between October 30th and November 1st are the new ones, just in case everybody needed the exact dates on that, putting that out there for everybody. But yeah, right. Unsafe working conditions don't get anybody anywhere. So that's what we're talking about. It's American Pharmacist Month, guys. Still an important time. And, during this time, I think it should be very much, at least on our pharmacy people's minds, that, hey, what we do is important. And for our patients, I hope you can see what pharmacists and pharmacy technicians and the pharmacy crews do are incredibly, important. All the reasons why we've gone through this a million other times, but, thank your pharmacy teams. Simple as that. That's all my request is in your Enlightenment Hour. Be grateful for the teams that are out there gutting it out for you. So if you have, a line and you just waited 20 minutes to get to the front and things are wrong, just try to be grateful for the fact that the store is even open, because there's, other places in this country right now where stores are shutting down temporarily. And so, I mean, again, you don't want to treat your healthcare providers like crap. Healthcare providers don't want to treat their patients like crap. Pretty simple, harmonious relationship there. It should be, right? But again, it doesn't always work that way. So just try to be light on your pharmacy teams. Of course, your healthcare providers, be thankful for them. American Pharmacist Month. Hey, but we're jumping into the actual next part here in our Herbal Wellness Corner. We're pushing through tonight. I want to make sure we get some good stuff on here as well, in terms of our cannabis side. Sharing with you guys. I'm going to share a video here from Bonnie Goldstein, cannabis doctor. I was able to do a podcast with her a long time ago, back in actually like 2018, like around the time when this video came out. But I want you guys to see what a cannabis doctor does, especially, one of this caliber. Bonnie Goldstein's been treating pediatrics with autism and cannabis since probably about the time since I was born, right? California legalized at that time. Check this out.
Adults. When I started my practice, it was mostly adults, but I just wanted to share with you, these are all some patients of mine that are using multiple different cannabinoids to enhance the quality of their lives, and these include cancer patients, children with genetic diseases, children who have had issues since birth, and it's been really very rewarding. Here's some other kids as well. If you could see the top middle photo, this is a little boy that was never supposed to walk, and he came walking into my office this year, so that's kind of amazing. The little boy all the way on your right on the top, said mama for the first time at age 6. So anybody who's worried about damaging little brains with cannabis, it doesn't happen. It appears to actually make brains move forward. The conditions that I take care of mostly are here. Treatment-resistant epilepsy by far is the #1 condition I see in pediatrics. However, autism is coming in as a very close second. Unfortunately, I do see children with cancer. Most of them are advanced cancers, metastatic, who have been giving poor prognosis. And as you can see, the other conditions. And one of the things that's very important to understand is that many of these conditions have an underlying root cause of endocannabinoid deficiency or dysfunction. Some of the literature is bearing out that these children clearly have an endocannabinoid deficiency, and I know there's going to be a talk on autism, but just in March of this year, Stanford University published a paper where children with autism had significantly lower anandamide levels when compared to children who were what we call neurotypical. So when a child is missing a compound in their brain that's supposed to promote homeostasis, I consider it malpractice not to correct that imbalance. Here, the rationale for use, again, evidence of the endocannabinoid system as root cause. Despite a recent, very recent, just this past Thursday, there was a article published in New England Journal of Medicine about medical marijuana for chronic pain, and there was a pro and a con. And the con said, we don't know the safety. Baloney, we know the safety of cannabis, thousands of years, show me the bodies. We don't see that. So certainly tolerated well by most. We don't see organ damage. The only time I really get concerned is when it's combined with certain pharmaceuticals, especially in children with epilepsy. No question that the quality of life of these children are being improved if they respond. And we do see like around an 80% response rate, which is pretty good. Certainly compassionate care, end of life. Now that we have tested medicine, and there's always been tested medicine, it just wasn't required here in California, but now everything that's on the market is pretty compliant with testing. I don't have to worry anymore. I can get a batch result and I can see what is in the compounds that the families are using. And most importantly with cannabis medicine, it's not a one-size-fits-all. You can customize treatment. I will share with you, these are 2 children, the little boy on the bottom, these are siblings, by the way, and the mom sends me these nice little milestone updates. First day of 1st grade for Casey on top, and her brother started 3rd grade. These are both children with epilepsy and autism. They had terrible quality of life. They're both on different regimens, and both, as you can see, are in school, and they look pretty happy, doing really well. I had this really cool animation where when I clicked the button, the little circles came up, but I lost that when I converted this to a PDF. So what I'm using in terms of cannabinoids for patients is I am using everything that is circled. So I am using CBD extracts, THC extracts, the raw cannabinoids, THCA, CBDA. We're also using just newly available Delta-8 THC for some teenagers with anxiety. So all of these, and by the way, some other compounds are available. CBN, which I haven't really used very much. I haven't found very good success. Maybe other people have. THCV is now currently available in California. Access to all the different cannabinoids is extremely important. I have some patients on 5 different extracts a day, multiple times throughout the day. Some people take certain cannabinoids in the morning and some take at night, but without the ability to customize or to have these available, and I often get asked to talk to families who are out of state. If they don't have access, sometimes we really can't get anywhere with the condition. So let's talk about CBD extracts. As Dr. Mashula mentioned this morning, of course, anticonvulsant, and that's been borne out in multiple studies now. We also know that CBD extracts can help with anxiety and aggression, and SIB is self-injurious behavior. Certainly analgesic. My own mother is using CBD for severe arthritis pain. It's been very successful for 3 years. She's been able to not take any other painkillers. Neuroprotection. Even in the patients that I take care of, like the children who may not respond with a great result with epilepsy, the parents still want to continue to give CBD to their children. Despite that it's not lowering seizures, they feel that it's protecting their child's brain, and they're seeing that their child isn't losing memory every time that they have a seizure. We also know CBD to be anti-cancer and in general decreases neuroexcitation. Interestingly, remember CBD is a stimulant in low doses, and it's more sedating in higher doses. And of course, this varies, a lot of individual variation, but I have found in the autistic population that sometimes the lower doses actually aggravate behavior, and as we go higher in dose, we can actually get an opposite effect, which is a more calming effect. Sometimes that turns people off. They may try CBD for their child, and usually in a very low dose, they see their child escalate behavior, and then they're terrified to use CBD anymore. But remember, these compounds are biphasic, so we're going to see an opposite effect. I like to divide the CBD into two types of compound or kind of categories: high ratio CBD to THC and lower ratio CBD to THC. And as you can see, I've listed some ratios. Those are not the only ratios that we use, but that is just an example. And the reason I do this is because I find that people often say, oh, okay, I got some CBD. Well, is it CBD with a 1-to-1 or CBD like a 27-to-1? Because if it's, they're going to give you different effects, and you cannot compare the two of them. And if you don't know what you're doing and you buy a 1-to-1 ratio and you go home and you dose it by CBD and you get stoned, you're going to be a little bit turned off to that if you're not looking for that effect. So I do like to categorize, and at least, again, reading labels so that you understand what is in the product that you're using. In children, I've listed the 5 most common terpenes that seem to be helpful for both seizures and for autism: linalool, pinene, limonene, beta-caryophyllene, and myrcene. So raw cannabinoids have been available now for a number of years in California. I find that both of them are anticonvulsant in my clinical experience, anti-inflammatory, and also in pediatric patients. This list of improvements that we're seeing, which is decreased anxiety, improved focus, better speech, less stimming in those children that have autism, better sleep, better appetite, less aggression. This is a picture of Catherine. Catherine came to me many years ago. She's one of my first pediatric patients, and when I gave her CBD, because that's what was available at the time. We had THC and we had CBD extracts. She did terribly. She didn't even last 2 weeks on CBD oil. Her seizures were escalated. She was on 3 medications. We thought maybe there's a drug interaction that we weren't accounting for, but her family was completely turned off to it, and they were not willing to even go and move any further with it. And about a year later, I noticed her name on my schedule, and when they came in, the mom said, you know, we tried 2 more pharmaceuticals and we were not getting anywhere. She was having a significant number of seizures every week and tremendous anxiety related. She felt every seizure coming, so we call that an aura, and it would create tremendous anxiety for her, which then created tremendous anxiety in the family. And when she came back to see me, we had some new information about THCA, and so we started her on that, and she had about 30% reduction of seizures and complete resolution of the auras. So the mother said the quality of life was tremendously improved. And when CBDA became available, we added that into the regimen. And right now, I'll tell you, she's 50% reduced on seizures. She's been able to wean off a very difficult drug called Omfi that's almost impossible to wean off of, and she's had no rebound seizures from the weaning. And in general, her quality of life has really been improved. And again, that's just on raw cannabinoids. She doesn't take CBD or THC. All right, THC extracts. You know, I read something about somebody saying that children, of course, don't use THC. No, they do. In my practice, they do. I do find that it is an added anticonvulsant effect for some patients. I, in fact, have one patient who the only thing that works to stop his seizures is THC. If you were going to design a drug for a child who may need to be on this medication for long term, THC may develop tolerance over time, so it's not the greatest, but what we found with this patient is that we've got the seizures so well controlled that we can back up a little bit on some days, skip a dose, maybe take a break for a day, and then restart to try to keep the tolerance down. In general, though, the child has no intoxication. He's at a pretty low dose, but it's made a big difference in his seizures. I also find THC to be very helpful when weaning the pharmaceuticals. AED stands for anti-epilepsy drugs. Also, what parents will tell us, and remember, if your child has an anandamide deficiency or an endocannabinoid deficiency, giving THC can help replace that deficiency. And so what we are seeing is improvements reported in focused speech, less stimming, better sleep, better appetite, decreased anxiety. I find THC in general to be very well tolerated. One of the things I explain to every family is that every person has a ceiling dose. And what we do is we start extremely low and we titrate up. If they see their child starting to have any kind of intoxicating effects, we've now hit the ceiling dose, and the goal is really to stay under that. Of course, we're not looking to intoxicate children. So the low concentration products, 5 milligrams per ml and 10 milligrams per ml, everything in basically standardized 1 ml syringe, which is easy to measure and give to a child, I find allows us to explore THC in very low, accurate doses with very little unwanted effects. Now, CBG is fairly new on the market. CBG stands for cannabigerol, and I have to thank a group called Whole Plant Access for Autism, and they have a poster and a booth, so definitely check them out. I'm on their advisory board. There's a nonprofit group that helps families with autism. There's over 8,000 families involved with them. They pointed out to me that CBG was out on the market and there were some families using it. So I delved into the research, and I'm not going to go through it all since time is limited, but if can take a picture and then take a look at these articles. But what's interesting is that CBG appears to work at different mechanisms than excuse me, some of the other compounds. And what we're finding, and let me show you this slide, is that they did a survey of 35 families, and as you can see, the dominant effects in these 35 families of children with autism were mostly beneficial. So you can see 31 out of 35 of the children had better mood. Increase in speech, decrease in anxiety, increase in focus, increase in social interaction, decrease in hyperactivity, increase in sleep, better appetite, decrease in some pain. That's kind of amazing that when you look at the top half of this graph, you can see that the dominant effects in this particular group of patients is quite beneficial. And what we're finding with CBG is it is an antidepressant, anti-anxiety, definitely changes mood, also works as an analgesic and anti-inflammatory. So I have started using this in patients. Many of the patients are combining it with other cannabinoids, and again, I mentioned this yesterday at a Q&A that I attended, and that combination cannabinoids seems to be very helpful for these children who have such devastating illness. In terms of dosing CBG, it appears to be fairly low dose, between 2 and 20 milligrams per day. It can be stimulating for some, so some of these patients were only doing it in the morning because if they take it in the evening, they will stay up all night, which is, of course, opposite of what we're interested in. And there is a report of a young adult that was shared through me through this Facebook group who had Tourette syndrome, and he decided to try low doses all the way up to about 100 milligrams, and he found that he had complete resolution of his tics between 25 and 40 milligram dose. So it's very interesting in that, in my experience with most patients with Tourette, you have to have a fair amount of THC, and he does supplement with THC, but in this way he might be able to use both so he doesn't have to take as much THC. And so I got through it, so I have plenty of time for questions.
Listen to her just a little bit.
Go ahead.
Good morning, Dr. Goldstein. Thank you for your work and your presentation. Is there a suppository of information that helps with pediatrics weaning from certain synthetics, other sort of pharmaceutical drugs? Or are you finding it more just specific to specific diseases that you've spoken about?
So in pediatrics, the drugs that we're mostly weaning from are anti-seizure drugs, or sometimes the children are taking either Abilify or Risperdal for autism. All of these drugs are usually very difficult to get off of. In general, what I've learned is that different doctors learn different things. There's no one absolute way. In fact, one of my friends who's a neurologist said he was taught a certain way in one program, and then he went to another program and they taught him a different way to do it. So I do think it's really a physician's preference. In general, I tell patients, especially if they're doing well with cannabis medicine, not to go fast. Don't rock the boat once we're actually seeing some good results. So I tell patients to wean 10% or less over a period of somewhere between 2 and 4 weeks, to do it slowly, especially as we move up on the cannabinoid treatment. We can kind of go slowly down. There's no reason to rip away drugs from a child who's actually finally got some stability. That's my approach anyway.
Okay, thank you.
Sure.
2 minutes remaining.
Hi there. My question is about the CBG. I know that yesterday at the CME talks that we had, cannabinoids were suggested in place without THC, so to speak, or for those that have schizophrenia or bipolar. And on that slide, CBG seems that it was also a possibility for improvement of antidepressant and anxiety. Do you have any negative side effects for CBG with schizophrenia or bipolar that you know of right now?
So I've only treated one bipolar patient with CBG who was already a patient doing well on a CBD dominant oil. When we added in CBG, she felt that it was actually helping her more in combination in terms of complete elimination of the kind of paralyzing anxiety that she still had breakthroughs with. I have not treated anybody with schizophrenia with CBG, but I certainly think it would be interesting to try.
Was that patient on any antipsychotic medications as well?
No, it was
None.
a patient who had already weaned off all pharmaceuticals and was doing well on cannabis.
Thank you.
We've got 10 seconds, Bonnie.
Okay.
In your regimen and dosing recommendations to children in your THC versus THC acid,
1 minute.
THCA, how do you really go about determining that spread between the acid part and the THC molecule?
Right. So, there's a huge inter-individual variation. Everybody responds differently. So in general, I use the same kind of motto that everybody uses, which is start low and titrate up. And of course, remember, this is out-of-pocket medicine and can be quite expensive. So what we're trying to do is find the lowest dose to give the desired effect. So pretty much with THC, I'm starting usually at a 0.5 milligram to 1 milligram per day or per dose, depending on the condition. And for THCA, I would say it's probably 2 milligrams or sometimes even under that for a patient with epilepsy.
Thank you very much.
You're welcome. Thank you, everybody.
So guys, that's Dr. Bonnie Goldstein. She's been doing this for a really long time. And, when you're talking about, someone getting a lot of anecdotal evidence and research and true data over, 20 plus years at this point, she's about number one. So when it comes to pediatrics and cannabis and things, obviously there's a lot of murky questions there. She's got some really good resources when it comes to, as she indicated there, autism, epilepsy, other conditions as well. And when you're looking at higher ratio things of CBD oil to THC oil, like 20-1, right, 10-1, or a lower strength ratio with like a 5-1 or a 2-1 or something like that. It's just very, very interesting there where you could perhaps see benefits, because the drugs that she's talking about, Abilify and Risperdal, those kinds of medications do have a lot of other side effects on top of being the antipsychotics that are incredibly sedating as well to, autistic patients. And, I've talked to autistic parents as well. They do not want to see their kids so sedated that they cannot enjoy their life, right? That's not a quality of life that you want for your child. So in terms of what we're trying to figure out there's still a lot of meat on the bone, a lot to figure out, but a lot of resources too for those who actually may need it. And I want to make sure people do have it. I connect you guys with the YouTube video for that there in the chat. But again, Bonnie Goldstein, she's everywhere and part of different organizations and nonprofits. And I would probably recommend getting on your own kind of Google terrain there. I have no issue, helping anybody out and guide them where they need to go as well, if you guys do hit me up on that. Otherwise, moving into the next segment, our community spotlight, highlighting the Boo to the Flu Clinic. It's the Las Cruces vaccination drive here this Saturday morning. So Saturday from October 28th from 8 a.m. to noon, while vaccine supplies last, at both Mountain View Regional Medical Center and Three Crosses Hospital. They're going to be doing flu shots out there. Literally, you can just drive through it to the flu clinic. Super easy in 2 different locations on both sides of town. Hope everybody has that, marked down if you haven't gotten your flu shot and you want a quick, easy way to not have to get out of your car. So putting in those details in the comments. Otherwise, we're moving on here to our Men's Health Minute. And again, maybe this is a little applying to both genders here, but I just thought this was, a great article. Why are Mondays, right, so mentally difficult? When you're looking at the Monday, it's interesting where you look at some of the data because surveys, most people, as you would probably say, Mondays are the most dreaded day of the week. So you look at that, right? How can you turn a dreaded day, right, into a positive day? Again, it could be a lot of different factors, which we'll hit, but being super sleepy, going into Monday, getting that weekend rest, like your body is already just adjusted to that. It's hard to get mentally challenged for, having a mega Monday every Monday for the general population. So things for us, like, in our Men's Health Minute here, talking about, hey, Mondays, how do you try to counteract that, right? Realistic expectations, right? What do you want? What do you want out of your job? Do you like your job? Do you like what you're doing on Monday? Is that part of that, right? Are you disengaged with what's going on? What is an activity that you enjoy on Monday, rather than a job that you may not enjoy or something that's going to happen? So, again, interestingly enough, if you find out to get hard out of bed, it can help to go to bed and get up at the same time every day, including the weekend. For those of you who sleep through the weekend, that's totally cool. It is just hard for your body to adjust back and forth. So something that somebody can do to try to make their Monday better, right? Try to maybe get on a regular sleep schedule, or consider, right? Perhaps even literally just consider a new job role or something that's going on in your life, right? Do you enjoy what you're doing when you go into it on Monday? Should you? I mean, you probably should when you think about your life. I mean, 52 Mondays in a year. You don't want to have that dreaded day 52 times. So just a lot of other things to consider there when we're looking at Mondays. But I hope everybody else has had a happy Monday otherwise. And we'll see you guys